A 54-year-old man. Chronic left leg pain and swelling, gradually worsening over the past 8 months. History of proximal DVT in the same leg. He completed the anticoagulant therapy. Now complains of leg heaviness and aching at the end of the day. Skin discoloration around the ankle. Venous ulcers. Unilateral leg edema. Hyperpigmentation and duration of the skin near the medial malleus. No calf tenderness, no erythema or warmth. Which of the following is the most likely diagnosis? This case should be confusing as multiple diagnoses share a lot of its features, and you should be able to differentiate between all of them. It's a very, very important skill and a very important way of studying to know the clues that differentiate a diagnosis from another. So let's look at the choices. Choice A is incorrect, and the reason should be clear because it's acute. CSDVT has all these features, the pain, the swelling, the heaviness, but it should be acute, so it's incorrect. Choice B, chronic venous insufficiency, incorrect too. It's not associated with DVT. It could be associated with obesity, pregnancy, aging, and it's due to valvular incompetence. Also, it's mostly bilateral, not unilateral, but it's not always, but mostly. Choice C is the correct answer. And this is a typical case of post-thrombotic syndrome, where a patient has DVT in the past and a year or within 2 years later, he develops these symptoms like leg heaviness and swelling and aching and ulceration, hyperpigmentation, all these symptoms mentioned in the vignette. And it's a type of venous insufficiency, by the way, but both have different causes and different names. Both occur due to venous problem, but this one is associated with DVT, as 50% of DVT patients develop post-thrombotic syndrome within 2 years, as we already said. And in this case, you should do Doppler ultrasonography to rule out DVT before you begin treatment. And you treat just like chronic venous insufficiency by compression stocking or bandages, and exercise like ankle flexion and walking. Of course, choice D also is incorrect. That's not how lymphedema looks like. There should be non-pitting edema, thickened skin. It's called Boud orange. Also, it's not related to DVT and no hyperpigmentation lymphedema. Many things to say. Also, choice E, peripheral artery disease, is incorrect. Also, what to say, it's never like this. There should have been claudication, cold limb, decreased pulses. Very much to say. So for now, this is how post-thrombotic syndrome looks like. And here are our side notes which I recommend you to read.